Not every bleeding in the middle of your cycle is ovulation bleeding. There are times when it can be a warning sign. Let me explain further so you can understand. Ladies, if you have ever noticed small bleeding or spotting in the middle of your cycle, maybe a week or two before your period, you might have asked yourself, is this normal or is something wrong? Listen, many women experience this, but don't talk about it. Some even panic, thinking it means miscarriage or fibroid or even serious diseases. So today, I want to break it down so everyone will understand. I will explain what ovulation bleeding is, why it happens, and when it's normal, and the situation when you should not ignore it. So make sure you watch till the end, because I will also show you how to tell difference between ovulation bleeding and implantation bleeding, which many women are very confused about. So let's start with the basics. What is ovulation? Before I continue, if this is your first time seeing this beautiful face, my name is Francarz, but you can call me Francarz. On this channel, I film content related to nursing, healthcare, and lifestyle generally as a nurse. So if you're interested in content like this, please give it a thumbs up, share this video, and don't forget to subscribe and turn on your notification bell so you'll be the first to know when I upload another amazing video. And with that being said and done, let's go straight into it. What is ovulation? Ovulation usually happens around the middle of your cycle, usually day 14 in a 28-day cycle. The ovary releases an egg, right? So this process is called ovulation. Now, when the egg comes out, your hormones levels shift, which is your estrogen, which was high before ovulation, suddenly start dropping, and progesterone begins to rise. That sudden hormone changes can make some women experience a light bleeding or even spotting. That is what we call ovulation bleeding. Now, how does it work? Ovulation bleeding is usually very light. Sometimes it's just a small stain when you wipe yourself. Sometimes it's light pink or brown discharge. It does not last long, most times only 1 or 2 days, and it's not heavy like a normal period. So women may also feel mid cramps or abdominal discomfort around the same time. Yes, so if you have experienced this before, don't panic, okay? Ovulation bleeding itself is perfectly normal. In fact, it's one of the signs that ovulation is happening, which means your cycle is very, very active and you may be fighter around that time. So, but here is where it gets interesting. So pay attention. Not every bleeding in the middle of your cycle is ovulation bleeding. There are times when it can be a warning sign. Let me explain further so you can understand. When should you worry? If the bleeding is heavy like a period, or if it lasts many days instead of 1 or 2 days, if it comes with severe abdominal pain, fever, or foul-smelling discharge, then it may not be ovulation at all. It could be an infection, hormonal imbalances, even fibroid, prolapse, or even pregnancy related complications. Another red flag is if the spotting keeps happening irregularly, like not just mid-cycle but randomly through your month. In those cases, it is better to see a doctor for proper checkup. Now, let's pause here and talk about something many women are confused about: ovulation bleeding versus implantation bleeding. Now, implantation on bleeding happens when a fertilized egg attaches to the womb, usually about 1 week before your next period is due. It can also appear as a light spot, like a light bleeding, but the difference is in the timing. Ovulation bleeding happens around day 14 in a regular cycle, a 28-day cycle, while implantation bleeding usually happens around day 20 to day 26, closer to when your period should come. Now, implantation bleeding is also usually lighter and very short, sometimes just a few drops. If you are usually active and your spotting comes late in the cycle, don't assume it's ovulation. It could mean pregnancy, that you are pregnant. So consider doing a test. I know this can sound a little confusing, but the key is to pay attention to your body and your cycle. Knowing your date makes it easier to tell what is normal and what needs medical attention. Now let's go a little deeper into why ovulation bleeding happens in the first place. Number one, like I said earlier, is the hormonal shift, like estrogen drops suddenly after ovulation and progesterone rises. And that small hormone can make the endometrium, that is the lining of the uterus, shed a little blood, right? Number two, the actual release of the egg can sometimes cause a tiny rupture in the ovary, leading to mid spotting, like a little blood. Number three, in some women, ovulation is associated with a slight increase in sensitivity of the cervix, which may also contribute to light bleeding. So, is ovulation bleeding dangerous? The simple answer is no, not by itself, but it is important to know when it's normal and when it is not. Ovulation bleeding is light, short, and happens around the middle of your cycle. Now, abnormal bleeding is heavy, prolonged, painful, or associated with other symptoms like bad smell, fever, or severe cramps. Now, let's talk about what you can do if you notice ovulation bleeding. If it is light, painless, and happens occasionally, like in the middle of your cycle, you don't need to treat it. Just take note of your cycle, like so you can track it. If it is disturbing or you are not sure whether it is ovulation or something else, see a doctor. They may do a simple test like a pelvic exam, ultrasound like a scan, or hormone test to rule out other causes. Another question women ask me is, Nurse, does ovulation bleeding affect fertility? The answer is no. In fact, it is a sign that ovulation is happening, right? Some women even use it as a clue to know when they are fertile. So if you are trying to conceive, spotting around ovulation, like bleeding around ovulation, can help you know the right time to have intercourse. But if you are not trying to conceive, be aware that bleeding or spotting at this time may mean you are in your fertile window. So protect yourself if you don't want pregnancy. Yes. I always tell women, don't ignore your body signals. Small signs like bleeding, spotting, cramps, or changes in discharge are your body's way of communicating to you. Learning to read them can save you from worry and also help you understand your health better. So before we wrap up, let me share something practical. Let me share practical tips. Number one, keep a period diary. Write down when your period starts and when it ends. And note, not unusual spotting or pain. Number two, maintain a healthy lifestyle. Stress, poor diet, and hormonal imbalances can all affect your cycle. Number three, don't be shy to see a doctor if bleeding is heavy, persistent, or associated with other symptoms. Exactly. It is better to check and be safe than just assume it's ovulation bleeding when it's not. So let's summarize this very quick. Ovulation bleeding is light spotting, right? That happens around the middle of your cycle due to hormonal changes when the egg is released. It's usually normal and harmless. But if it is heavy, painful, or comes with other warning signs, then it may be something else that needs medical attention. And don't confuse ovulation bleeding with implantation bleeding. Yes, timing is key differences. I hope this video has answered all your questions. So you see how simple it is. So if you find this video helpful, please give it a thumbs up, share, subscribe if you haven't already, and share it with someone who may be confused about their cycle. And I want to hear from you in the comment section. Have you ever experienced bleeding or spotting in the middle of your cycle? Was it light and was it harmless? Were you scared? Let's talk about it in the comment section. Thank you all for watching, and I will see you in my next video. Bye.